Good evening, everyone, or good morning, depending on where you're calling in from. We're going to get started in a few minutes. We're just going to wait for a few more people to join, and then I will introduce our special guest, and we'll get started. If you're just joining now, just why don't you pop in the chat where you're joining from? Joining in from London. Welcome. If you're just joining, we're just going to wait a few minutes, wait for a few more people to join, then we will jump in. We'll jump straight in. Hello, CW from Canada. Hey, Darren from Washington. John from Manchester. Hi there, Fraser from Edinburgh. I hope you're well. Phil from Oxfordshire. Hi there, Phil. Lee from Washington. If you are just joining now, we're just going to wait a few minutes for a few more people to join, and then we will get started. Why don't you just say hello in the chat? So we're calling from Jolie from Wisconsin, Jean from Ireland. Gary, will this be recorded? Yes, it will. But you won't get the opportunity to ask Dr. Ben your questions directly. So missed opportunity there, but it will be recorded, yes. William from New Orleans. Great. Thanks for joining, William. Good to see you. Simon from Nottingham. Steve from Wales. Okay, let's jump in. I think a few more people will be trickling in. Hello and welcome. Thank you very much for joining. My name's Dr. Ed Farrer. I'm the CEO and co-founder of Otto. If this is your first time joining, then Otto builds digital programs to help people manage tinnitus. If you're coming back again, you know who we are. Thanks for joining again. So guys, we've got a really exciting special guest for you this evening. And it's my pleasure to introduce Dr. Ben Thompson. If you guys have spent any time online researching tinnitus, which I'm sure all of you have, you'll have heard of Dr. Ben. So Ben's an audiologist and tinnitus expert with a really popular YouTube channel. Created, I think it's over 100 education videos. That number might be old now. I suspect it's more than that. Ben trained in California, and he's worked with directly with the founder of Tinnitus Retraining Therapy, Dr. Pavel Jastrabov. Ben, thank you very much for joining us. Whereabouts are you calling from?
Excellent. From San Francisco, California.
Great. Well, it's good to have you with us. I'm going to let you, so Ben's going to give us a presentation on Tinnitus Retraining Therapy. So I'm just going to let you jump straight in, Ben.
Excellent.
Guys, before I do, actually, guys, if you have any questions, please pop them in the Q&A, and we'll get around to them. But over to you, Ben. Thank you.
Excellent. Yeah, this is most fun when it's interactive and you get to ask questions along the way. So as of this point moving forward, if you have a question, please find the Q&A section on Zoom and type in your question, and then we'll get to it later. And if you have questions that are just totally independent, something that's really been stuck for you, you need help with, you can ask a question, or something regarding the presentation. So yes, my name is Ben. Great to meet you. Let's get started. I want to present on tinnitus retraining therapy. A quick introduction to myself is I, back in 2018, was working at a hospital clinic in San Francisco, and a patient drove 4 hours to see me for a tinnitus consultation appointment. They had already seen their local audiologist, they had already seen their local ENT doctor, but they weren't provided great options. They weren't really given a roadmap forward. So that was my aha moment when I realized there must be a more convenient way to match professionals who know how to help tinnitus with the people who really need the help. So started a YouTube channel that has now grown to over 8 million views. And we have also brought on a team of audiologists to offer services directly to patients. So we have tinnitus retraining therapy that's available via telehealth, and we work within the United States in this tinnitus retraining therapy model. So that's a quick introduction to us, and my specific role is managing our team, making sure the quality of care that we provide is excellent. As was mentioned earlier, we'll be discussing tinnitus retraining therapy. Now, I find that for those who have really done their research or done looked at a lot of information on tinnitus, you may have come across this term, but it's often misunderstood. My personal mentor is Dr. Jastroboff, who's the founder of Tinnitus Retraining Therapy. He's been known in our field, in the audiology, hearing, and tinnitus. Some might say tinnitus. I say tinnitus. And in this field for decades. Essentially, tinnitus retraining therapy is a protocol to follow that I'm going to get into the specifics of what it entails. But here's the first main point. And I'm very happy to collaborate with Ed and with the Auto app on this, because I know we all are aligned on this very point, which is, you may have heard from others some version of, quote, there's nothing you can do for tinnitus. And that's inaccurate. There are things you can do. I'm sure that if you've been using the Auto app, or if you've watched some of my videos, you've learned a few of those things, or at least hopefully changed your perspective that there's something that can be done. And this is the first important point that we must address, this false belief that, quote, there's nothing you can do for tinnitus. Tinnitus retraining therapy, in this article, is highlighted to say that reports from a number of centers around the world indicate high levels of effectiveness of this method. So today I'll talk about TRT, the retraining therapy. I'll provide an introduction to sound therapy, which is part of TRT, and then I'll answer your questions. Tinnitus retraining therapy comes down to these two main pillars. On the left, we have expert care with an audiologist that essentially, from an observer's perspective, means one-on-one sessions, counseling type sessions, which are designed to get an individual out of the negative cycle of tinnitus. What this means is you can sometimes get caught in this trap of anxiety, stress, noticing more tinnitus, louder tinnitus, and activating the fight or flight response. This is something that happens to many individuals who are dealing with bothersome tinnitus. So just knowing that there's tools and techniques which can be taught to you in a one-on-one consultation, counseling type session over time to get out of this system, that if we implement these tools on a daily basis, that your brain can learn to reduce tinnitus over time. And that impacts the awareness of the sound as well as often the volume of the sound over time, okay? That's one of the pillars, expert care with an audiologist who's trained in tinnitus retraining therapy. On the other side, we have sound therapy via Tinnitus Maskers. Essentially, this means using sound enrichment, having medical devices that are programmed for tinnitus. They're playing these types of soothing sound that we call sound therapy, and that mixes in with the tinnitus perception so that your brain can have some immediate and short-term relief from the sound, more easily able to be in quieter environments, plus long-term reduction of tinnitus. These are the two core pillars of tinnitus retraining therapy. And what we do essentially when I am performing tinnitus retraining therapy, the gold standard, the highly recommended way to do this is by using ear level masking devices like these ones here on the screen. They sit up and behind the ear with a thin wire going alongside the skin. Sometimes these are referred to as hearing aids. Other times they're referred to as tinnitus maskers. You do not need hearing loss to use these devices, because if you are dealing with mainly a tinnitus problem, then these devices will work. How they work is that they have this rubber tip that goes inside of the ear canal, and the rubber tip plays the sound therapy through a small high fidelity speaker. The rubber tip that's in there, it has some natural holes in it, so that means you're still able to hear conversations around you. It's not blocking your hearing like headphones or AirPods or earbuds. Now, additionally, to experience tinnitus retraining therapy, to go through the program, you would be paired with a professional who's trained in this method, and you have personalized coaching using different kinds of methods. Some are designed to change the mental reactions. Others are practical tools that you can use on a daily basis. And this leads to a targeted treatment that can impact the loudness, the intensity of tinnitus, as well as associated conditions like sleep difficulties, anxiety, sound sensitivity, hyperacusis, etc. Now, here's, in my opinion, the most important graphic, the most important image here to learn, to understand when you are dealing with bothersome tinnitus. This provides a roadmap, a guide of what is the goal here. When this is all said and done, what should I expect in terms of improvement? This is something called the 4 stages of habituation. I also refer to it as the 4 stages of tinnitus relief. And most individuals who are here or who reach out to our team, for example, are in stage 1 or stage 2 of these 4 stages. The goal is to get every one of you to stage 4. Okay, so stage 1 is characterized by having the highest awareness and annoyance of tinnitus throughout the day, frequent worrying and anxiety regarding the sound, and it's often accompanied by loss of sleep or appetite. Now, waiting, watching, maybe trying some things on your own, you may notice things get a bit better, but it's very common for folks to be stuck in either stage 1 or stage 2 for an extended period of time and not get the kind of help that they need. The goal here, and with a targeted treatment following tinnitus retraining therapy, individuals can move through this system. They can move through these stages so that they reach stage 4, where tinnitus is rarely noticed. We can quickly redirect our attention from it, and it no longer elicits automatic negative feelings or thoughts. Remember earlier I said sound therapy is a big part of tinnitus retraining therapy. And I describe this as the passive component. So once you get these devices set up properly and you're using them on a daily basis, then it's very easy. It's passive. Essentially, these devices here, we would refer to these as the Tinnitus Maskers. You can also have hearing aids that are programmed for tinnitus. This would be our top rated option for sound therapy devices to follow tinnitus retraining therapy. You would wear them on your ears for about 8 hours a day. And until you reach stage 4 of habituation, you're using these devices because they're beneficial, they're helpful, and most people who use them enjoy wearing them because they make being in quieter environments a lot easier, and to know that you're following the protocols for sound therapy whenever you have them in. At the end of the process, when you reach stage 4, you do not need to wear these devices on your ears anymore. That's an important point, is that once this treatment period is over, then these medical devices they don't need to be used on a daily basis anymore. You don't need to use them. So it's a big important point. Now, what if you already have hearing aids? Yes, you can get those hearing aids programmed for tinnitus if you're working with a specialist who knows how to do this. What if you don't want hearing aids, or what if you don't want anything on your ears? Can you use AirPods? No, I don't recommend you using AirPods because they block your ear canals in a way that you can't hear ambient noise around you. It's not sustainable. It's not recommended for sound therapy for long-term use. Can you use a sound machine? Can you just play sounds in your room? Will that work? Yes, that will work. The important point here is the tinnitus maskers on the ears, they're not the only way to get good sound therapy and follow the protocol, but they're the most practical way, because you'll quickly notice if you're trying to have good sound enrichment around you all the time through a sound machine, for example, people around you might not like that. You might not be able to do that at work. You might not be able to do that at home during all hours of the day. Well, that's what the protocol calls for, to use sound therapy for most hours of the day. So a sound machine I find is a good complement to the tinnitus maskers or hearing aids for tinnitus sound therapy, but probably not going to be used in isolation. Some common sounds that we play through these types of devices would be white noise, pink noise, natural water sounds, then more custom sounds like crickets we found very popular for our patients, as well as we've collaborated with some sound engineers to produce custom sounds like silk and shimmer and some other more custom branded sounds that we have at Treble Health. If someone's really struggling with sleep, then using sound therapy with a sleep headband with some thin speakers alongside the headband can be very effective. So these are all the tools that we found using tinnitus retraining therapy, as well as seeing hundreds and hundreds of patients every month that are actually moving the needle and reducing tinnitus. So that's what I'm presenting here to you. You can also use smartphone apps that can play some sound therapy, and that's probably similar to a sound machine in terms of its use. But I find that it's hard to rely only on a smartphone app for sound therapy because there's notifications. You might get a phone call. The phone has its own audio stream and audio source. If we can get the sound therapy to be independent, programmed inside of the tinnitus maskers or in a sound machine that doesn't need Bluetooth, then that would be preferred. All right, I see some good questions coming in. We're going to get to those in a moment. I want to do a quick time check. All right, I'm going to go for 5 more minutes here, and then we'll open it up to questions and engaging with you all in the chat. So thank you. Okay, so what does pink noise even sound like? Maybe you've never used this before. I want to demonstrate what this sounds like. If you're very sensitive to sound, or if you know that sound might trigger you, then please turn your volume down right now. Wouldn't want to do that. For most people, this will be just fine. I'm going to sample some pink noise. It's going to come in through your computer, through your iPad, through your phone. It won't have the best sound quality because we're doing this over the internet. It's coming in through your phone. But you can get a sense of high quality pink noise coming in through devices in your ears, how that may mix and interact with your tinnitus. So I want you to turn down all the sounds around you, and let's just listen to this pink noise for about 10 seconds and see how it mixes in with your tinnitus. Ideally, we want the pink noise to be softer than your tinnitus, so the sound therapy does not overpower or is louder than your tinnitus. All right, so here we go. Let's listen to this pink noise for about 10 seconds. Notice how that may have mixed in with your tinnitus, and just after 5 seconds, it becomes sort of this background sound, and we're able to focus on other things. That's the power of sound therapy. This is, again, just a rough audio demonstration. Let me play another type of sound. This is from a type of hearing device that we use at Treble Health called Widex. And inside of these Widex devices, we're able to program more custom sounds that do not rely on Bluetooth inside of the devices. So we found them to be very helpful, and the response we've gotten from our community is very positive with the patients that we're using these sounds with. So this particular sound is a combination of Zen tone chimes as well as ocean waves. There was a question here in the Q&A from Robin, who asked, what is the difference between your TRT program and the Widex Zen TRT? So essentially, Robin, the difference there is the difference here is just what is programmed inside of the devices. So our tinnitus retraining therapy program, we can, inside of the devices, program pink noise, white noise, the Widex Zen tones. We can program different custom sound therapies, and based on how the individual reports and responds, we can change the settings over telehealth so that what's actually coming through the devices is providing the most relief for you. It's not a one-size-fits-all approach, and you're essentially, the differences would be how the devices are programmed with the different types of sounds. Good question. Let me now play the Widex Sound Relax. This is a tone this is a sound relax tone with the chimes and the ocean waves. So I want to hear from you guys in the chat. Was that helpful? Did you prefer the pink noise or the sound relax? Which one was more soothing? Which one gave you a bit more relief? And I'll be looking out for your answers in the chat. I'm just going to go for another few minutes here, and I wanted to share that I do not want you to think that sound therapy is just some short-term distraction technique, because although it does provide relief and help when we're using it in the moment, the real benefit here is that following tinnitus retraining therapy over time leads to the best reduction of tinnitus, promotes habituation, gets us to stage 4 that I showed you earlier. And this independent research looked at 2 groups, one group that just used sound therapy through the devices on the ear, on the left side, and then another group who followed tinnitus retraining therapy, which is the sound therapy with devices on the ear, plus the one-on-one audiology counseling sessions. And what they found was that, just reading the discussion here of the report, both groups were effective overall. By 12 and 18 months after the treatment, the tinnitus retraining therapy group showed considerable gains in effectiveness compared with just the sound therapy alone. So this research was really important to showcase that following tinnitus retraining therapy is the recommended route for most of our patients. It's not conflicting with CBT, with cognitive behavioral techniques or cognitive behavioral therapy. It's just that independently, this really works. So I wanted to highlight that, also to have the right expectations that we don't expect this tinnitus to significantly reduce in days or weeks. We know that this often takes 6 months or more. So be patient, have the right kind of expectations there, and it will pay off. With our team, we had 247 patients that came through our program, and we saw a significant reduction in tinnitus at the 3 months mark with the tinnitus functional index, where the tinnitus functional index score was reduced by 20 points on average. And then at the 6 month mark, it it lowered down to 25 points 6 months after starting our program. So the results we're seeing here are, hey, tinnitus can get better, can get quite better. And people are going from, say, a 7 out of 10 down to a 3 out of 10 in 6 months. That is something that not many people hear. So that's the kind of message that we want to share about what's possible. We're actually leading a summit, an online summit, yesterday as well as today. And some of you may have attended, let me know if that's the case, where we're showcasing some success stories, some graduates who came through our program. They're essentially sharing their story of what they learned. They eventually graduated from our program and are doing quite well after being in very challenging positions with their tinnitus. So all this to say, there's absolutely hope. Work with the right team, use the Auto app, work with a specialist who can guide you through this. Tinnitus retraining therapy can be used in conjunction with the Auto app, for example. So I think that's why we're really doing this collaboration. Again, here are the Tinnitus Maskers, these sound therapy devices, which promote habituation. Here's this sound machine, which you can use for day or night. And that's my presentation. So Ed, I'll pass it to you and we'll see who we can help with some answers coming in.
Thank you, Ben. Fascinating. Really, really interesting to hear about tinnitus retraining therapy. As I say, we mainly focus on CBT, so it must be good to get to hear directly from you, tinnitus retraining therapy for our audience. So we've got quite a few questions here. So let's just work through these.
Yes.
First one we had, someone's emailed in, Michael emailed in, and he's got 2 questions. Firstly, question about Treble Health and the services you offer. Can he access your programs in Ireland? Where can patients access Treble Health?
Great. So to work with us for tinnitus retraining therapy over telehealth, we only work with individuals in the United States. We're licensed health professionals. This is where we have the licensure to practice. There are resources in Europe, so I do recommend to do your research, call your local centers, look online, even reach out to the Auto team. I'm sure they'd be able to help you find a local specialty clinic to do some in-person services.
Thank you. So we've got kind of some general questions here. Let me try and cover the tinnitus retraining therapy related questions first.
Sounds good.
So Mar's asking, where do you find these sounds if they're not programmed? So I think that's kind of a question about how does she access the sounds, perhaps if she doesn't have a masker, or where's the best place to find these sounds?
Yeah, I would say, I know the Auto app has some sounds. I know that on Treble Health on our YouTube channel, we have some sounds. Those will be good places to start. We can link those below. And if you're just playing them through your phone or through a speaker at home, then that's probably the best place to start. If you wanted to, upgrade, then working with a professional that is an audiologist in your local area or with our team at Treble Health would be a way to upgrade and have more sophisticated devices.
Thanks, Ben. Yeah. Okay. So I'm going to go back to we had another question from Michael about Linear. I'm sure many of you have heard of Linear. For those of you who haven't, it's a relatively new medical device that provides what we call neuromodulation therapy. So you put a piece of plastic on your tongue that provides electrical shocks, and you'll listen to some sounds with headphones at the same time. Thanks for posting that. So and Ben's just posted the link to sound therapy in the chat. So if you want to check out the YouTube channel, check that out there. Ben, do we have any feedback from Linear from patients in the US now that it's been approved by the FDA? Michael used it in 2022, and it unfortunately didn't help him. What's the response been in the US since it's been launched?
Yeah, there's some data on this. Give me one moment because I actually did a presentation on this a few weeks ago, so I can do a very quick summarized version of what we found looking at that data. Give me one moment. All right, so yeah, this is important for everyone to be educated on your options. So essentially, the linear device out of Ireland, it's been available for a few years in Europe, but it was approved for safety in the United States and became available in 2023. It's out of a company called Neuromod in Ireland, and this is a 2022 study that is the most recent publicly available study from their group. And essentially what they found is that they used this tinnitus functional index to show the improvement of tinnitus. And at the 3-month mark, the average reduction for 191 individuals, was about 15 points. And then at the 12-month mark, they measured the same group. They saw, okay, the improvements they held, they even got a little better over time. So I was comparing this linear device with our research, what we've done with tinnitus retraining therapy, and essentially the takeaway is linear from their data did show a clinically meaningful improvement in tinnitus. In my opinion, the data is not strong enough to be recommended first in place of gold standard tinnitus retraining therapy. However, they both can be used in unison for those who wanted to. How we're recommending the possibility of linear to our community and to our patients is to say we would recommend, based on the data, that someone proceeds with tinnitus retraining therapy as their foundation, and someone can also use CBT here, right? I would say those are the more two tried and true methods. Bimodal stimulation, linear, it's still very new. Even though the data is encouraging, it's not leaps and bounds. It's frankly not better than the existing gold standard treatments. So we're monitoring it. For those who want to try it, they're often encouraged to do so. And I recommend really meeting with a professional who can go over your specific case before you just try to decide on your own.
Thanks, Ben, and thanks for sharing that. Just want to reiterate that I would definitely second that. It's still not showing anything significantly better than the current gold standard of care, or the current available options. So Ben, we've got a question here from one of our guests, who said they did TRT and it got a lot better in 6 months, which is great. But then after 2.5 months later, some irritating noises came back. Sounds like a tinnitus spike or a flare. They've asked, what's a good way to kind of manage this?
Yeah, so a few points is that I'm glad that tinnitus retraining therapy worked. Without knowing your individual case, I would want to know, why did you stop? Maybe was it too early? Maybe we stopped prematurely before it was really finished, and that's why it came back. Or if there was something that spiked or made your symptoms flare up, then let's just work on bringing it back to where it was and managing whatever caused the flare up. So I think you're in a good spot no matter what, and I would follow up with whoever you worked with on the TRT to just assess this, whether you are truly done or maybe we need a few more months here. Thank you.
Thanks, Ben. So Donna said, Donna doesn't have tinnitus every day, so it's quite variable by the sounds of things, but it is bothersome when she does have it. And she's asking what happens if the appointment with the audiologist for the sound therapy device is on a day when her tinnitus isn't bad.
Yeah, great question. I found that about a quarter of people have fluctuating tinnitus, where some days are better than others. So it's sort of this moving target, and some days it doesn't bother me at all, but some days it's really bad. This is we see that in about a quarter of our patients. So essentially, with sound therapy, you need to have it set up in a way that you can adjust and customize it based on the changes that you're going through. And the goal here is you have these fluctuations, but they're usually tied to some baseline level of tinnitus. So the goal is reduce the baseline over time, limit the intensity of the louder bad days, and you'll see improvements slowly over time. So just make sure you can customize the sound therapy. Devices on the ears can do that. Even a sound machine with an app can do that. So I think it'll be all right, and that's how to recommend it.
So I've got another question from Mark. What does 15 points mean? Is that the percentage of reduction? I think when you were talking about the reduction of the tinnitus.
Yeah, great question. So let me share my screen here, because I was actually comparing a few different research studies. One of them was something that's not available yet, which is the Michigan Tinnitus device out of Dr. Sue Shore's lab. Another was Lanier's data from last year. And then we had our own internal, not yet published data from Treble Health. So in terms of apples to apples comparison, the 3-month mark was used amongst all these studies. And you might ask, okay, what does this mean? I don't really care about just a number. I don't know what it means. Practically speaking, the average person who came to us had a 60-point tinnitus functional index score. And at 3 months, the average person reduced that by 1/3. So essentially this is saying 3 months after starting, the average person who came to us improved their tinnitus 33%. That's what a 20-point difference would mean. Practically speaking, this is to say it was a constant 7 out of 10. Now it's a 4 out of 10. Now it's a 5 out of 10. That would be a real world example. So it was bothering me in most situations. I was hearing it 80% of the waking hours. It was really causing me a lot of anxiety and stress. 3 months later, you may notice I'm not noticing it as often. It's much easier to manage. I'm not feeling as much fight or flight, anxiety, stress. So this is what a 20-point difference would do. And then, similarly, a 15-point difference would be some degree of that, but not as much.
Yeah, thanks, Ben. The way I like to describe it to people is that the two things will be happening. A, they'll stop noticing it, so maybe noticing it for a much lower percentage of the time. B, if they do notice it, won't bother them, won't make them feel anxious or frustrated, anxious or sad like it did in the beginning. Probably won't even make them feel kind of frustrated or angry as it does further down the line.
Excellent.
So I hope that's answered your question, Mark. So for you guys, we're covering the questions on specific to TRT first, because I think it's whilst we've got Ben here, I think it's best to cover those questions. I'll try to get through as many as possible. So Sharon's asked, if doing sound therapy, do you need to do 8 hours in one block, or can you do a few hours at a time around work?
You can do a few hours at a time. The 8 hours is just general. It's a very generalized statement, because some people have a work environment or hobbies that are very noisy. They don't need sound therapy when they're, by the river all day. Similarly, if someone is at home all day and it's very quiet, well, that person might use 12 hours a day of sound therapy. So it's dependent on just trying to have sound enrichment during the treatment period, trying to avoid silence, not because we're scared of it, but because we know that having sound around us, having sound in the system can help the brain retrain the tinnitus over time.
Absolutely. Question here about pink noise versus white noise. So they said the pink noise you tested before worked well.
Mm-hmm.
Can that pink noise be used with a white noise machine? How does that kind of those things work together?
Yeah, so if you have a white noise machine and it only plays one sound, then if that's working well for you, you can absolutely use it. If you have a sound machine with multiple sounds, then using sounds that are similar to pink noise, similar to white noise, just use your ear. Does it sound similar? If it does, then that's fine. Essentially, pink and white noise mean that there's a broad range of sound. So it sounds sort of like this type of sound, and you can use anything that plays that type of sound and it will have a benefit. Some sound quality of some devices are better than others, but to get started, yeah, a sound machine would be fine.
Thanks, Ben. Okay, so great question here from Jolie. If you're in a stage 3, so what Jolie's referring to here is stage 3 of habituation. Remember, Ben showed us the graph of progressing from stage 1 through to stage 4. And Jodie's asked, if you're in stage 3, would you still recommend TRT for 8 hours?
I would say if you've had tinnitus for a number of weeks or under 2 months, and you're already in stage 3, you probably don't need the full tinnitus retraining therapy protocol. But if you've been dealing with this for a decent amount of time, you're not yet out of the woods with this, then you can use tinnitus retraining therapy in full, following the protocol or some modified version based on what you need in your individual history. And that can get you to stage 4, quicker and easier than just trying something on your own. So use it in that way. Hopefully you're close to stage 4. But if you just kind of waited and did nothing, you might be lingering in stage 3, which when it's all said and done might might be worse than just using tinnitus retraining therapy now to get to stage 4.
Awesome. Guys, thank you. Keep the questions coming. We're going to try and get through as many of these questions as possible. There are a lot of them. So thank you to those of you that ask questions. Let's keep going. So question from William, what is a tinnitus flare? Describe a tinnitus flare, he's asked.
Essentially, you have tinnitus and it's louder, and it's sustained loudness for hours or days. So that would be considered a flare-up.
Yeah, it's often we find that once people have habituated, they can then go through a stressful period in their life and their tinnitus can get louder and get worse. It's happened to me a few times actually with my tinnitus. And but I think it's always easier to habituate. Easier. It's if you've habituated before, you can habituate again. Okay, so question here from an anonymous attendee. What do you recommend when the brain sees pink or white noise as nothing but noise and the ears are getting worse with this type of therapy?
So it is nothing but noise. I mean, that's quite frankly what it is. It's not designed to be anything else. It's designed to show you that a neutral, constant sound is non-threatening. It's not dangerous. It's not going to harm us. It's not even important. Well, when the brain takes that experience through classical conditioning and it puts the same principles on the tinnitus sound, then the brain is able to categorize tinnitus as it's actually well understood. I know what it is. I know what to expect here. Not dangerous. It's not going to harm me. It's not going to kill me. Okay, I don't need to put so much attention and bring this to the front of my mind. That is exactly what happens when someone can habituate. So sound therapy, in my opinion, is very helpful for that. That's the tinnitus retraining therapy protocol. CBT, cognitive and behavioral techniques, are also very helpful for that. So you can see here that there's just different ways to approach this, but ultimately that's the same goal that we're all after. To specifically answer your question, if you're noticing your tinnitus is getting worse with anything you're trying, then just stop and, if possible, speak to a professional who can really understand why. If something's making your tinnitus worse, in most cases, that's just a time to pause and reassess. It's not always an absolute stop what you're doing, but in most cases, it's just pause and reassess.
And I'd encourage anyone to seek medical advice if that is the case, if their tinnitus is getting worse despite trying things. Okay, so Ben, final question from me actually. We talked about the kind of the majority of the topics of these webinars is we talk mostly about cognitive behavioral therapy and CBT. What's the difference between CRT and CBT, and how do they compare?
The main difference is the mechanism in the brain that is used to reduce tinnitus. Think of it this way. What does cognitive behavioral therapy really mean? It means changing the mind, changing thoughts, and changing behaviors. Okay, well, that's something that we understand. Okay, changing thoughts, changing behaviors. Those thoughts might affect our emotions, so we're touching on some of the emotional piece of it as well. That has a place. I believe everyone who finds relief from tinnitus is able to change their attention, change their thoughts, change their emotional response in a way that promotes relief. So we're all doing some form of CBT, those who are graduating, those who are getting better, right? Tinnitus retraining therapy has the use of the sound therapy and a strong emphasis on education. What the education does is it allows your subconscious brain to, without you trying, recognize the tinnitus is not a threat. It's not dangerous. It's not going to harm us. It's a benign body sensation. Without you like forcing that from a thought or emotional perspective, your brain learns that and it helps promote relief subconsciously. So that's essentially my take on it. They're not conflicting in any way. You can do both at the same time. You can try one and then add on the other. Most of people who get better with tinnitus, quite frankly, are using some form of education, sound therapy, and these mental reactions, emotional regulation as well.
Yeah, and that's one thing I regularly say to people is find out what works best for you. Try different things. There doesn't just have to be one thing that you focus on and that be it. Like, as you said, Ben, often a combination of approaches is what's most effective. And Nancy is doing both, combining Otto and Treble Health. Thank you, Nancy.
Hey,
I hope it's
Nancy,
going well for you.
Nice to see you here.
So we've talked primarily about tinnitus retraining therapy, and we've mentioned cognitive behavioral therapy. So if anyone's interested in accessing both of these things, either through Treble Health or through Otto, we're going to spend a few minutes just talking about how we can do that. So Ben, if people here have been interested by what they've said and they're interested in tinnitus retraining therapy, how can people get in touch with you guys?
Yeah, absolutely. The way to get in touch with us is going over to treblehealth.com. I'll include it in the chat. And essentially, just a quick plug, we do have something called the Tinnitus Relief Bundle. So this is essentially taking tinnitus retraining therapy, putting the best sound therapy devices, as well as expert care by our audiology team into one package. And you would sign up and work on this for a few months. There is a 45-day money-back guarantee. It's only available for individuals in the United States, and you can find more by heading over to treblehealth.com.
Thanks, Ben. So guys, just to reiterate, if you're interested in giving TRT a go, head over to Treble Health. I think, do you guys offer a free consultation as well to see if it's...
We do, yes.
Yeah. So head over to Treble Health and Ben's team would be more than happy to tell you about. If you're one of the people that's heard about cognitive behavioral therapy and you're interested in giving CBT a try, I've got a really exciting offer for you guys this evening that I'm just going to quickly share my screen. We're going to do a quick plug as well. So we've just launched this new 90-day tinnitus tune-out package, primarily focusing on CBT, and you get a whole load of value for this. So we're going to teach you how to turn tinnitus into background noise with our digital CBT program that you can access through the app. Many of you will have heard about this and you've tried this already. So you get 3 months access to the digital CBT program. You're going to get monthly specialist group coaching sessions. So one of the things Ben mentioned was education. We're going to provide education from one of the best and a monthly package. And they're going to show you how to get quick results. One of our tinnitus specialists based here in the UK. You'll get one 45-minute session per month. We'll build you a custom habituation plan. So Ben mentioned the 4 stages of tinnitus relief. We want to get you from stage 1 to stage 4 as quickly as possible, regardless of the type of tinnitus you've got. And this is a good way to get results if you struggled before, because we'll just personalize this to your tinnitus. Every month we run a tinnitus, tune-out tinnitus success stories. Guys, these tinnitus success stories are so important because they provide hope. Treble Health provides success stories regularly, and Ben mentioned that they're running a seminar at the moment. So sign up to that tomorrow and go and hear from people that have successfully habituated. If you want to hear that from Otto, we'll provide these directly to your inbox each month. And secondly, finally, we'll get priority support from our world-class team. So we've packed as much value into this as possible. This is worth over £350 if brought together. But today, I'm really excited to offer this for £199 for 3 months, which is a 40% discount on that. If you're in the US, that's $249. So if you sign up today, guys, the next 24 hours, you're going to get a free 30-minute call with me. You can hear about my personal experience with tinnitus, find out what's worked for me. And you'll also get 1 year's access to the Otto app, so you're fully equipped to manage tinnitus flares, tinnitus spikes, whatever it throws at you. Very quickly, we have a 30-day money-back guarantee, and we have a 90-day success guarantee. So if you don't get significant results by the end of the 90 days, we'll refund you double your money. If you want to sign up, guys, I'm going to send you all an email afterwards, but I'm also going to put a link in the chat that you can click on to sign up. But I'll email all this information to you afterwards. Ben, it's been really, really good to hear you talk about TRT. Thanks so much for joining us. I'm hoping we can do this again at some point, because I think I speak on behalf of everyone. It's been really valuable to hear about something that we don't normally talk about. So thanks for joining us, and I hope you've enjoyed it.
Absolutely. Thanks for having me on. Really, really glad to collaborate here. And for everyone who's here, thank you for spending your time with us today, and hope to see you soon.
Great stuff. Thanks everyone for joining. There'll be a recording available through the Otto app tomorrow. Thank you, guys. And thanks, Ben.
You're welcome. Take care.